Welcome to this educational video. I'm Dr. Maria Bugeya, a nephrologist, and today we will be targeting the relationship between diabetes and kidney disease, with detail into what we can do to prevent the onset and progression of diabetic kidney disease. Kindly note that whilst this video is based on evidence, it is primarily for educational purposes and it should not replace medical advice when deemed necessary. So, what is the relationship between diabetes and kidney disease? How can we prevent its onset and progression? The kidneys are two organs located on either side of the back, the function of which is very important for overall health and well-being. Amongst their functions, some of the most important include removal of toxins from our bloodstream via production of urine, control of blood pressure and fluid levels in our body, and maintaining important electrolyte levels within normal limits. Other important roles include bone health activity and regulation of normal red blood cell levels. We know that long-standing diabetes, especially when uncontrolled, can affect the small vessels of our body, including those of our kidneys. It can lead to irreversible scarring and result in progressive loss of function. What is worrying, unfortunately, is that this process does not give you any symptoms before it is advanced, and therefore, educating ourselves about how to prevent it, regular checkups to identify its onset as early as possible, and appropriate treatment is vital to prevent long term progression and associated complications. Both blood tests and urine tests are necessary for routine screening. So, what can we do to prevent the onset and progression of chronic kidney disease? We should control our blood sugar with close surveillance and advice from our healthcare professionals. We should control high blood pressure if present. We should aim to lose weight, stop smoking, avoid over the counter medications that can affect kidney function, be compliant with any medications prescribed by health professionals, and in case you find difficulties or need support, you should inquire about enrolling to a structured diabetes education program, unless this was already done. In summary, our goal should be to prevent rather than treat diabetic kidney disease, keeping in mind that if we detect its onset on routine surveillance, fortunately enough, there is evidence-based treatment that will slow its progression. Having gone through the basics of diabetic kidney disease, I would like to add a brief comment about the outlook of this condition. Really and truly, it depends. It differs from person to person. It depends on the age of diagnosis. It depends on how much the diabetes is controlled. It depends on the compliance of medication and of lifestyle measures that I've already explained. It depends on how many regular checkups we do. What I can say, and what is very important to understand, is that if we diagnose it in the early stages, it can be reversible with treatment. If it is more advanced, then unfortunately it is usually irreversible, but treatment can help it slow down its progression. Last but not least, I want to stress out the point that we should look at diabetic kidney disease as part of a chronic condition that affects more organs. We know that diabetes is associated with heart disease, and therefore symptoms related to the heart, such as chest pain, should be taken seriously. We know that can affect our eyes, and we should be screening for diabetic complications in the eye, because the earlier the diagnosis, the better the outcome. We should be checking our nerve function and circulation, and this is very important to prevent foot complications. Thank you for viewing this educational video. Please Subscribe to this channel if you wish to follow further patient education content.